Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center, and this is Tuesday, August 15th, 2023. We are a group of 9 healthcare providers now at Tustin Longevity Center and are meeting once a week, soon probably to be more, to just try and create another venue for our families, our patients, our staff and friends to join in, ask some questions that are general health questions and issues, and then get a functional, integrative, alternative medical approach. We are standard trained medical doctors and naturopaths and nurse practitioners and physician assistants working here. And our goal is to prevent disease and to address lifestyles. As we all know, about 90% of all disease is lifestyle mediated. So this is our effort as a clinic to be a source for our team, our patients, our family here at TLC Health Freedom Tribe. And we are trying to create this venue. So to do that, we take emails. I have emails. I don't have as many this day as I had last week, but we get emails in, and at the bottom here, you can hit the link and join our email list. You could go to tlcdoctors.com and get on our email. Then you can get notification when the next one is. It's always every Tuesday at 6 p.m. And when you get that email notification, there's a link in that box, or you can click on it, and there you can type in your question. It'll go directly to that list of emails that are designed for these Ask the Doctor Anything Tuesday night list. The other thing is we have the YouTube live chat here, and you can type in your questions here. And our goal is to try and get to all of them. I think I will be able to tonight because I don't see quite as much of a heavy dose to try and cover. So with that, we'll begin, and I will start with our live chat. The first question we have here is from Paul, and you have gadolinium toxicity. The medical journals show the most effective chelation agent is DTPA over EDTA. What are the other factors you consider using DTPA versus EDTA, and what do you recommend? All right, so I don't know the anachronism for DTPA. I know there's D-penicillamine. I know that there is EDTA. There is what is the name of it? I can't think of it right now. These other chelators are more specific. DMSA is what I'm trying to think of. DMSA, which is more mercury focused. So yes, there are unique chelators out there for specific metals, or they have a larger affinity for a certain metal. However, the history of it does not, it pales in comparison to the 70 plus years we have of history with EDTA, plus the broad spectrum of chelation and safety record of EDTA. And because I've been using this for, well, I've been around it since I was 7 years old and saw my own grandfather with severe unstable angina. That's resting chest pain. So he could be doing nothing and just start getting chest pain. And I was 7, and they only had nitroglycerin back in the 50s for that. And my father learned about the EDTA, got him EDTA chelation in the Great Lakes area where the work and research and first cardiologists started using EDTA for the off-label use for ischemic heart disease. And so my grandfather lived to see me go to medical school. So that's pretty remarkable, given that there weren't all these fancy drugs or invasive procedures available, and it was only EDTA chelation. And I really don't think he did much lifestyle changes as well. So we know about EDTA chelation. we know its safety record, and we know its broad spectrum chelating abilities. So if you're going to start reducing your gadolinium from prior scans, I presume, you would want to also know that at the same time, I've seen gadolinium go immediately down. I have never seen EDTA fail, not once. So that's my recommendation for you, is to go with the EDTA. And I'm going to write myself a note, because part of the time that I have is learning from my patients. So it's DTPA, chelation for gadolinium. And that's the heavy metal that's used in all of the scans that we're taking. So I will talk next week about DTPA and see what that anachronism really is standing for. So hopefully that helps you, Paul. I've never seen EDTA do anything but other than really help everyone live a longer life. If you go on YouTube and you type in tech update, TACT update 2019, Dr. Lamas, Lamas, you will see him talk about the wonderful National Institute of Health funded research on 1,708 known heart attack patients on standard care, and the remarkable life extension they had compared to the likelihood of repeat heart attacks and death after the first heart attack. And then right under that 15-minute video of Dr. Lamas, you will see the ACAM lecture. It's an hour long from Dr. Dorothy Merritt. And I would have you watch that, because that covers an hour's worth of all of the all-cause mortality reduction by using EDTA chelation. It's well worth your time. Let's see. And then the next question is Tara. Tara says, Dr. Rita, what do you think about modified citrus pectin for heavy metal detox? Thank you. Well, even drinking enough water is helpful in detoxing, even for heavy metals. You can make an argument for any good antioxidant. You could say glutathione helps with heavy metal detox. You could say vitamin C helps with heavy metal detox. You could say cilantro, the herb, helps with heavy metal detox. You could bring up chlorella, helps with heavy metal detox. You could put in garlic. Any sulfur-rich antioxidant would do that in particular. And so heavy metals are cations. They're positively charged. Anions are negatively charged, and they attract these cation, positively charged toxic heavy metals. So you can make an argument for all these things. The same for zeolite, volcanic ash. So I'm not going to put them down, and I'm not going to say don't take them. But when you talk about effectiveness, looking at reduction over a short period of time with each interval of dosing, it's dramatic, and the history behind it. So you would have to show me a lot of modified citrus pectin studies, dramatic improvements, miraculous limb reperfusions. You would have to show me miraculous memory deficit reversals, miraculous ischemic heart disease reperfusion, nuclear scans with modified citrus pectin for me to choose that before EDTA chelation therapy. Now you can use them together and you can get an additive effect, so no doubt about that. Even the oral ingestion of EDTA has value. I helped create the suppositories for that and did the clinical studies on it and the animal pharmacokinetics on it. So I'm not going to say that they aren't valuable, Tara. I am going to say they are valuable and they do have some effect, but nothing like the history and the safety record and the testing and the decades and decades of years of hundreds and millions of dosings of EDTA chelation is so well worth doing that. Christine says, I am a 21-year-old type 1 diabetic with a hemoglobin A1C of 6.6, not bad for a type 1 diabetic, and I'm 10 weeks pregnant. Well, congratulations. Because I'm pregnant, I have hypothyroidism, and my maternal MFM, again, that anachronism, maybe that's your fertility specialist doctor, and OB, put me on 0.075 milligram of levothyroxine. They also found a large cyst behind my uterus that they think might be endometriosis and are talking about doing surgery in my second trimester because it's the size of a large orange. And if the mutation that he has, and am even more at risk for getting one since I'm pregnant. So I didn't see that jump there on your statements. My doctor wants me to take 81 milligrams of baby aspirin, but I really don't want to be taking any kind of pain medicine. And if I don't have to, do you know if there would be any more natural or safer remedies or things to help instead? Any advice, tips, or really any help at all would be greatly appreciated. Well, first of all, congratulations. And it looks like you've been doing a good job on trying to take care of your blood sugars and control them. You have to be very careful if you're a type 1 insulin-dependent diabetic about monitoring your blood sugar levels. One of the things I don't like about insulin management on type 1 diabetics who use insulin is the reference to taking food in case it drops low. So they'll tell you if your blood sugar drops below a certain range on testing to eat something, drink a glass of orange juice. And this makes the volume of sugar and how much juice you drank or how much food you ate very problematic in fine-tuning control. And your baby will need you to try and do your best job at controlling your blood sugar to be the healthiest it can as it grows and gets ready to be delivered. So glucotabs are much more referenceable. So if you were to have a low blood sugar, I would have glucotabs there and be able to keep the count of how many it took to get your blood sugar back up if you needed to, because you have to have a very controlled carbohydrate diet. And all the more reason to get someone to be advising you on exercise and on your diet during this time. I tend to be cautious with dietitians who, in my opinion, are not invested in their patient in general, at least the ones that I've worked with, in that the dietitians follow the American Diabetic Association recommendations, which are too high of a carb. Regarding having some cyst, of course, I'm not trying to treat you over the internet. This is general advice, but cysts, ovarian cysts, endometriosis is a chronic metabolic scenario from high blood pressure, high blood sugars, and control of blood sugar is the best thing for it. And now a natural way to help digest this and pain relief would be for the inflammation of the cysts, the irritation that high blood sugars generate. High blood sugars create damage to the lining of the blood vessels. That inflammation then is picked up and creates long-term chronic medical problems. Cysts can form, endometriosis can form, and God has given us naturally enzymes, systemic enzymes to help that. And so we have used systemic enzymes with our pregnant patients for decades. Then that would be things like bromelain, the nanokinase, streptokinase. These are concoctions of natural existing enzymes. And typically you'll take on an empty stomach so that they're absorbed systemically. And they help to reduce inflammation of swelling and cysts and any irritated part of the body. So they're naturally occurring, but you could use those safely during pregnancy. We have certainly used them, and that is what I would recommend over against aspirin. The other thing is you need to be well hydrated. You have to have a commitment to drink half your weight in ounces as pounds. So if you're 150 pounds, 75 is half your weight in pounds. So that's 75 ounces of water, especially being pregnant and having diabetes. So exercise and water are stalwart functions of improved circulation. The enzymes are very valuable as a natural anti-inflammatory. Taking a very good nutrient antioxidant, and we use in our clinic here, we use the Juice Plus. We have many women who have been pregnant who have used Juice Plus to get 30 different fruits, vegetables, and berries, nutrient concentrate without all that sugar, which would upset the diabetes. So that would be an excellent choice for you. The Juice Plus series, you would take 2 fruit, 2 vegetable, and 2 berry capsules every day. And that would go a long way to help with a healthy pregnancy. Then taking vitamin D, we strongly encourage all our ladies who are pregnant, in fact, all of our patients, to take vitamin D at least 5,000 international units a day with vitamin K2. And so that helps prevent calcification of the blood vessels. And the other thing we would recommend is iodine, a natural salt. Iodoral is the name of the product, Iodoral, Iodoral. And it's 12.5 milligrams of iodine salt. And that improves the intelligence and helps prevent what is considered, a risk for mental retardation in the infants, for improved mental acuity, better IQs. If you look at women in Japan and places where they eat a lot of seafood, seaweed, their daily average consumption is 12.5 milligrams of iodine a day in their lifestyle, some much higher, some as high as 50 milligrams a day. So we choose to use the safe, low lifestyle dose of 12.5 milligrams, and I've been doing that for decades with my pregnant patients. Even my own grandchildren use this. And then we put them on a very good multivitamin mineral. Ours is called TLC Energy Core, and we prefer that over the standard prenatal ones because we know of the high quality that goes into each of the ingredients as opposed to the pharmaceutical brands that don't use the highest quality of their nutrient sources. So that's the base of a wonderful multivitamin mineral called TLC Energy Core, or anything that's high quality. The other would be the Juice Plus to get away from all those fruit and starches in all that fruit and vegetables, so you get the wonderful nutrient density, iodine, and then vitamin D. And because you have a known cyst, I would take systemic enzymes that work as a natural anti-inflammatory. And then I would have a healthy control of my blood sugar using glucotab rather than food rescues if you have any drops in your blood sugar, so that you can know exactly the dosing to get your blood sugar up without overshooting it. And that's what a lot of type 1 insulin-dependent diabetics do. They eat too much and they overshoot it. And so they're always chasing their rescue consumption versus their insulin dosing. So use glucotab for tighter control, and exercise and plenty of water. And that's our general recommendations we give to all of our patients and to all of our insulin-dependent diabetics. And we wish you the best. And we hope you let us know how things go, Christine. Let's see, the next question is from Juices. What is the best fasting length to increase telomere length? I don't know that we can actually, the more we study it, the more research is done on fasting and its benefits. We're starting to realize people are different, everyone's special. And what might work for a male who's 25 and already athletic, he can get into a intermittent fast of 18 hours, let's say, and start getting into ketosis and start having those epigenetic parameters in his cell and intercellular fluid that promote preservation of the telomere. And so for him, 18 hours would begin to be protective. Then let's say you're talking about another man who's 25 who is under a lot of stress, and he has a desk job, and he doesn't have a lot of time to exercise, and he lives in a stressful city with a lot of pollution, and he's 30 pounds overweight, let's say. It might take him 36 hours to start seeing enough fasting time before the ketosis, or even more time to work to start having telomere lengthening. So the mere fact that you're asking that question, that you're looking into a time restricted eating, maybe occasional prolonged fasting of 48, 72 hours once a month, or fasting like that, we would certainly endorse. But everyone's different, and the fact that we're all starting to do this, the fact that we're all trying to have a longer empty stomach so the body can have more of its blood supply working on healing the rest of the body and preserving the length of our telomeres. The proposition is that telomere length is associated with longevity. Those are the end caps on your DNA strands, much like the little plastic on your shoelace. You have that little plastic wrap there, and if that gets worn off, the ends fray, and then it's hard to make usefulness out of your shoelace anymore. So I don't think there is a best fasting length. It is what you can live with and be consistent with. So if you are living a lifestyle and you've just said, I will always eat between noon and 6 p.m. and I will never eat late. Once a month, I'll do a 48-hour water fast or 72 hours. And leave it at that. That's going to extend your life just because of all those things you do together. And if you layer on top of that good sleep hygiene, exercise, good water, keeping the food that you do eat in those 6-hour eating windows rich and healthy, wild-caught, prairie-raised beef and poultry and stuff, you're going to get the phospholipids like we show here to create the double membrane of your cell membrane. So the damage in the membrane there can be repaired overnight. And that's the direction I would say. And then, Paul here, he is saying what the name of that is. Let's see what it is. Diethylenetriamine pentaacetate. Okay. Pentaacetate. Okay. So I haven't heard of that one yet. Diethylenetriamine pentaacetate. So, okay, we will look that up. I don't have my second computer here to look into it, but Paul, give me the time to do that. I'm very busy. I've worked all day, so it's a long, long day for me to do these videos, and we'll work on that, okay? Let's see. The next question is, that's also from Juices, who says, let me get this thing here. What is the best, fasting. Okay, how can I make hydrogel liposomal vitamin C? I don't know that I can tell you how to make it. Essentially, it's taking phospholipids, these things that we get from when we eat meat, chicken with the skin on it, shrimp, crab, lobster, egg yolks, pork, bacon. All these things are rich in these fats called phospholipids, which are these little fatty acids that hang off of a glycerol molecule. And these fatty acids are rich in those foods. And if you get phospholipids, now we have it It's so valuable, and we've done so much research with this already on our cell membrane repair for chronic fatigue. We have those phospholipids here in a powdered form. Now, we have to mix it into warm water because fat doesn't dissolve into water, very well. So, I suppose if you took this phospholipid and you mixed it with vitamin C powder, your vitamin C is going to last longer in your gut and have a slower time release. And you can probably get higher serum levels. It's just a process of creating these micelles where the phospholipids will naturally make little spheres because they are repelling water, and the inside of that sphere is what you want to have contain your delivery load, like vitamin C or any other item you want. For instance, your LDL particles are basically these fat protein membrane spheres that contain all these contents of triglycerides and other fats and items. And so, yes, you could use the phospholipid to do it. Deborah says, recommendations to shrink and prevent recurrences of breast cancer after my surgery. Again, general advice, we would recommend to you a very low carnivore, strict keto type diet, because there's the argument by Tom Seyfried, PhD, that cancer is a metabolic mitochondrial disease. And this is the mitochondria are the little batteries inside of your cell. And your heart cells will have something like, 50,000 mitochondria in it. And then your regular cells will have maybe 5,000 to 10,000 mitochondria in it. And they are very dependent on having antioxidants to deal with the burnt smoke and debris of energy production. So every ATP that you produce is a burn. It's an oxidation pathway of passing electrons on to create that energy bond of ATP. And in the process of it, you generate free radicals or reactive oxygen species. And you have to have antioxidants who will sacrifice themselves and give up a electron, donate an electron, and deal with these free radicals and absorb them. So when that's damaged, it's usually kicked off by a high carbohydrate, fruit, sugar lifestyle like the American diet. And it then makes cells lazy, always expecting cheap, high octane fuel of carbohydrates, and the fat burning propensity of the mitochondria to burn things down as 2 carbon units to make your energy is lost or suppressed because we're always eating cheap fruit sugar and starch sugar diets. And then the mitochondria starts not acting well, and then the DNA gets damaged, the energy production goes down, and then the cell doesn't function well, and it's like it's oxygen starved. And with that oxygen starved, there are triggers that I believe in what is called the trophoblastic theory of cancer, where when the oxygen is diminished, the cell DNA in the nucleus wakes up like when you were a very two-celled item or a single-cell item coming down after fertilization for 4 or 5 days after fertilization. You're dividing and growing into this glob of cells without any lungs or heart beating, and you need oxygen real fast. So written in the DNA is the ability to grow blood vessels, and that's how the placenta is started and embedding into the uterine bloody lining of the uterus to start getting nutrient through diffusion. And that embedding and growth of that placenta is stopped around day 56 when the pancreas is formed and starts to work, and the beauty of the development of the human being. So what you want to do is drink enough water to get all your little capillaries perfused, exercise so you get the hydraulic pumping, keep the passages unsticky by eating a very low carb, low fruit sugar, or more carnivore like strict keto diet. Don't eat late at night ever, because you need to have that nighttime for repair. Take systemic enzymes that, like little Pac-Man, clean up these areas of micro injury that just being alive generates. And take a very good antioxidant. Again, we here use the Juice Plus capsules. Take your vitamin D. Vitamin D is maybe more a hormone than it is a vitamin. It's fat soluble and is associated with better immune function, better killer cell, T cell function. CD4, CD8 ratios are improved with vitamin D. So your immune system is enhanced. And taking a good multi-mineral vitamin that has the selenium in it. We have the TLC Multimin that has the 200 microgram selenium that has known anti-cancer benefits. And then I like doing EDTA chelation periodically, an IV maybe once a month or 10 times a year with high-dose vitamin C. There are many studies out there published looking at cancer stem cells being disabled in the presence of high-dose vitamin C. And that's because cancer cells lose a lot of the characteristics of a differentiated cell. And one of them is making catalase. Catalase is very important as an enzyme in processing out free radical oxygen species like hydrogen peroxide. And we need hydrogen peroxide as part of our intracellular and vital handling of life's pathogens and viruses and bacteria that we're all living in symbiosis with. And cancer cells don't have that, though. So if you take high-dose vitamin C and they don't have the enzyme catalase, the vitamin C gets into the cancer cells like all the other cells, and it kills them. So this is well studied. The catalase dependent healthy cell versus catalase absent cancer cell can't do it, and you kill off cancer stem cells that way. And some hypothesize that that's yet another reason why people who do EDTA chelation with high-dose vitamin C live longer. That's why I created the enhanced chelation formula that we use here, where I put both the EDTA with the high-dose vitamin C in for every infusion that we have. And systemic enzymes clean up the debris. And that's how I would approach it, Deborah, as a general rule. Sean the Baptist. Okay, let's see. I've heard recently about deuterium accumulation as an index for disease in the body, and that we ought to deplete it and avoid accumulation. What are the best lifestyle changes for that? Well, it's been released into the environment. These dirty bombs, and I don't know, there have been thousands and thousands of atomic detonations on the Earth. And deuterium is a radioactive phenomena, and we should work to reduce all radioactive heavy metal toxins, and chelation would be my number one suggestion. Doing that periodically throughout all the years of your life, at least quarterly chelation if you're young. If you're older, say past 55, you need to do it more dedicatedly, because the likelihood of disease developing increases with age. But in general, taking good antioxidants, again, that's another argument for the wonderful research and outcome with the Juice Plus series antioxidant, and being low carb. So you have very good, well oxygenated microvasculature capillaries, and that will prevent clogging and cells choking out. So I would do the chelation. I would do systemic enzymes to disinflame. I would take Juice Plus. I would take vitamin D. I would be on the very low carb diet. I would exercise with dedication, 150 minutes a week, both weight training and aerobic. I would have good sleep hygiene because that's when we heal. I would never eat late at night, and I would be more like a carnivore too. Remember, it is the proteins, fats that are in the protein that repair the damage in the cell membrane throughout our body, and that's what deuterium would do. All right, let's see. Christine says, where did you go? There you are, Christine. Hi, what would you recommend for factor V Leiden blood clotting gene other than 81 milligrams of aspirin during pregnancy? Well, all the things I had mentioned before in general for the diabetic type 1 that we just talked about, it's the same thing. We're the same biological entity, and we have the same mechanisms for healing. So you're going to hear me repeat this over and over because God is a God of order and logic, although it is so complex, even one cell to the universe. Just bringing up foolish people out there who claim they're scientists say, they can create one cell life. That's ridiculous. It's never been done. The complexity we know now in one single cell with a nucleus is beyond the ability of any scientist anywhere to ever have done. The same for the universe and the Big Bang and all that. There are as many astronomers and astrophysicists and physicists and mathematicians that are young Earth, 6-day creation believing, who are out there, but their data and their papers published are being suppressed, just like ivermectin and hydroxychloroquine have been suppressed. There's so much volume of these reputable scientists out there doing their work, laying the data, that it is so reinforcing to the absolute logic of the layout of the historicity of the Bible. So when we talk about answering questions like, what do you recommend for factor V Leiden blood clotting gene other than aspirin? I would certainly recommend, again, water. One of your best anticoagulants is drinking enough water every day. Half your weight in pounds as ounces. Exercise. Exercise prevents sludging, and it moves the fluids around and creates the environmental osmotic and hydropressure in the capillaries for fluid movement to move forward. So all the cells get their cleaning and delivery of nutrients. Eating an unsticky lifestyle diet of low carb and low fruit sugars, and taking systemic enzymes to prevent clotting, like the Vascuzyme and Vitalzyme. 3 once a day of the Vitalzyme or Vascuzyme, or if you're more concerned, use it twice a day. It's safe in all situations. I've never seen a situation it's unsafe for. And using antioxidants because clotting is triggered by the intrinsic and extrinsic pathways, like a extrinsic, a scratch and bleeding. And you want clotting so you don't continue to bleed out of that scratch. And then the intrinsic would be the damage, for instance, from the stickiness and of shear trauma, the shear force of the cells and material passing by the endothelium, the inside lining of the blood vessel, and they scratch it because there's so much sticky sugar and carbohydrates. So when that happens, it triggers the clotting factors. So that's why water, low sugar, taking enzymes, exercising, getting good night rest, all these things matter. And then eating the repair mechanisms for that lining of the blood vessel, the endothelium cell membrane, is this literal thing right here, the phospholipid bilipid layer, protein and fat. So that's how I would say that there. And then what's the next question? Estrella says, can a 3-year-old take OptiMag Neuro for constipation? Yes, and I would start out with, I think the 1 scoop has 4 grams of magnesium. I don't recall off base, but just start with maybe 1/4 of that. mixed in water, and put a little vitamin C powder, vitality powder with it, and make sure they're drinking enough water instead of all these marketed pimped sugar drinks and juices and orange juice. I would never give my child juice, never in 1,000 years. Instead, if they want something, I would let them eat, peel an orange and have some slices of it. That way, at least they'll get the fiber and it'll slow the sticky sugar down. But I think just play with it and offer it to them in doses and build it up. And even if they got too loose, a diarrhea from it, then you just cut back, no harm done. Debbie says, I'm a little concerned because my adult grandson moved out recently and is confirmed to have TB by 2 blood tests. Should my husband and I be tested? It sounds reasonable. You can go to your doctor or the county health department and get the skin patch test. And if you flare up, then you should see your doctor or get the treatment for that, or a chest x-ray and be monitored. Yeah. Harlow says, oh, beautiful. Thank you, Harlow. I'm on hormone replacement in my 60s. What should my levels of testosterone, estrogen, and progesterone be? Well, in general, Harlow, I think for a woman, we have been underestimating the value of testosterone for retaining our muscle mass. I like to see women have a testosterone level of at least 50 to maybe 100, somewhere between 50 and 100 on testosterone. Estrogen, I'm going to say that's a little more variable. I've seen women who are very satisfied with estradiol levels of, 35, 50. And then I see other women who have hot flashes at that level and they need more. And then we have gone up to as much as 200, 250. But pretty much all women are in that 50 to 250 range. There's a rare few on the either end of it on the bell curve, but that's the range for estradiol. And progesterone, I like the progesterone to be 4 picograms per deciliter or higher. I would be more comfortable with a 6 or an 8, but progesterone I've seen can go up to like 40 and still be quite normal. So some women get too groggy, too sleepy with a high progesterone level. So as long as it's a 4, 5 range, then I think that's good enough. And then Harlow goes on to ask, which of these 3 hormones cause breast sensitivity? Well, you would say the estradiol largely, but it goes away after time. Like when we're little girls and our breasts are just starting to form, there's very little breast tissue. But when you're a mature woman with mature breasts and you start estradiol therapy, it's got all this breast tissue it can work on, and you can feel it right away rather than the gradual build over the year or two as a child into your young adulthood. So you can gradually increase it, or just know that you can go through about 3 months of just being aware of drinking more water and taking the systemic enzymes like Vitalzyme or Vascuzyme. And I would use like maybe 5 twice a day if I had tender breasts until my body equilibrated, and always use the progesterone to balance the effect, and a low-carb diet, and take iodine, and maybe avoid caffeine so much. Caffeine tends to make tender breasts as well. And all these things would be improved if you had fibrocystic breasts. Sean the Baptist says, use the phospholipid mix with non-GMO sodium ascorbate in a jewelry cleaning sonicator for the liposomal vitamin C. Interesting. Yeah. All right. So there you took the phospholipid mix and you put it with the sodium ascorbate, and you put it in the jewelry cleaner, and it creates these little liposomals. Very, very good. Okay. Because if you put fat in water and jiggle it, that's pretty rough in a jewelry cleaner. But in general, you don't want to break up the micelles either. That's what homogenization does to dairy. It destroys the cells in the cell membrane. So you got to be careful about how high you have that vibration going. G says, how much protein daily, grams per day, do you recommend to those to not lose muscle mass as we age? I would say 1 milligram per roughly 0.8 pounds. Okay, so or 1 milligram per kilogram. So if you weighed 150 pounds in kilograms, that's roughly cut in half, 75, 70. You'd want about 70 grams of protein a day. That would be my minimum. I think you're very safe to eat 100 grams a day and take a higher amount up to 1 milligram per kilogram or more. Some people use 1.2 milligram per kilogram. I try and aim for about 80 according to my weight, and 100 for optimal. And then you got to use your weight training. I do my weightlifting 3 times a week with a personal trainer on heavy weights. So you got to do that too to preserve your muscle mass. My exercise is mat Pilates and dog walking. Well, that's a lot of steps. And so I would say, it's very good what you're doing, but in general, I would say you have to do some heavy weight training under the guidance of a personal trainer. She said also, G said, I started light weights as well. Good. But navigating my 120-pound dog on a leash helps my arms as well. I'm going to say you need to do your weight training, okay? We need to really set time aside under the guidance of a trainer, especially as we're older, to get all the deltoids, the pectorals, the latissimus dorsi, your core, your leg extensions, like leg flexions, hip abductors and adductors, and then your quads, doing the leg press. I just think you have to do those 6 exercises all the time. All right, so the next thing is, Jesus, thank you. All right, now let's go to some of these internet questions. Carolyn says, good evening. I had questions a few months back about some severe stomach pain and cramping and headaches that I've been experiencing. I've come to the conclusion that it is a sensitivity or allergy to sage, maybe some other spice, not sure yet, through food and blood testing with an allergist. Okay, before knowing this, I had 3 bad bouts of these symptoms lasting 1 to 5 days. In the past, I had an anaphylactic attack and that brought me to the ER. Besides having an EpiPen, what can I do if I accidentally eat sage and get one of these terrible attacks? Well, prevention is the thing. And then I would recommend anyone with allergies to take quercetin all the time. Quercetin is in our DHIST, 200 milligram per capsule. I take 400 milligrams a day. Sometimes in the bad allergy seasons, I take 800 milligrams or 4 capsules a day. Also, my internist mentioned I could get a CT scan with and without contrast. What are the negatives to CT scans and contrast? I do have a sensitivity to chemicals too. Thank you and God bless. I am on a paleo diet already, gluten and dairy free, as I have rheumatoid arthritis. I think I would go all the way to a more carnivore diet, and I would eat that way for 3 months to heal your gut lining. And then you could go back to paleo and some vegetables, because apparently you're getting aggravation of your allergies. Now, I don't understand why your internist wants a CT scan, other than he just wants to look at your abdominal contents, your liver, spleen, adrenals, kidneys, uterus, ovaries, intestines, and the structures in there, and just make sure everything looks normal. But I think ultrasounds are less invasive. The gadolinium, like the other gentleman who had that question about that DTPA, for chelating out gadolinium, has its toxicities. It's cancerous along with everything else. Fortunately, you can do a chelation right after a CAT scan here or the next day, so you can reduce and pull that stuff out. So unless there's some reason for it, You might ask your internist if he would be satisfied with an abdominal ultrasound, pelvic ultrasound together, so you wouldn't have to take that dye, but he may have reason to ask for it, so follow with what your doctor says. Christine says, is there anything a man can do to mitigate the symptoms of hormonal treatment for prostate cancer? Exhaustion, physical weakness, extreme hot flashes. He's also has a suprapubic catheter. That is a tough one, Christine, but really exercise, a high protein diet, taking multi-minerals rich in zinc and magnesium, taking systemic enzymes to reduce inflammation, and plenty of water. So a rich protein diet with healthy fats, the enzymes, the exercise, enough water. These are some of the best things. And zinc has another thing is vitamin D. Vitamin D will help with mood and a sense of well-being. I'm in favor of DHEA to help with the adrenals. I've never seen it aggravate in my 43 years of practicing medicine. I've never seen it aggravate anything with testosterone at all, especially in a man. So that would be my recommendation. Broer says, hemoglobin A1C management, I am conscientious with limiting carbohydrates, including a keto diet that works well, keeping off weight. I am a thin guy naturally, a low BMI, and never in my life have I been even close to obese. I exercise and run a mile a day. Anything to help keep my A1C in the mid fives. It's 6.5 now. Berberine, turmeric, thank you very much. Well, some of this depends on your age, Roar, because the older we get, our muscle mass diminishes, even in men. And that is another engine that burns the daily consumption of our carbohydrates in. So aging is associated with muscle wasting. Loss of muscle aggravates blood sugar consumption and processing. So I would seriously look at trying to be more of a carnivore type person. You could try it for 3 months and repeat your hemoglobin A1C and watch it dramatically drop down to 5.5 in 3 months. You know, it'd be just tremendous. I would not want to tolerate a hemoglobin A1C of 6.5. Now, berberine is excellent. Now, if you've got a quality product, and I can't speak to all the things that are out in the stores there are shams, even in the alternative world, just wanting to make money off of people. We use here clinically researched, ours is called TLC metabolic formula, in which we put berberine, and we're putting somewhere in the realm of 600 milligrams. That acts like a metformin. Then there's alpha lipoic acid that helps with sugar metabolism. Then we have vanadium and chromium and things like this to help. And then it works really, in my opinion, better than metformin on my patients who use metformin. But that's the direction I would head there. Deanne says, Dr. Rita, I'm 85 and had a hysterectomy 42 years ago. I take 2 meds, Armour Thyroid, 60 milligrams daily, and Estradiol Vaginal Cream, a 0.01% twice a week. My recent blood test revealed my hormone levels, DHEA 202. You must be on DHEA. That's a very good number. Estradiol is 11. That's very low. Testosterone 45 is decent, and progesterone is 0.2. That's meaningless. Are these levels okay, or should I make adjustments? Well, again, Deanne, we don't practice medicine over the YouTube, so I would ask you to talk with your doctor. You should be on more progesterone to get that level to about a 4. Instead, it's 0.2. And then your estradiol at 11, you need more estradiol. The DHEA and testosterone are fine. I'm healthy, active, good weight, and my recent bone density revealed that half of my scores have moved from osteoporosis to osteopenia. Good. Would it be a cancer risk to apply Estradiol Vaginal Cream every 3 days? I think you should, yeah. Thank you for the blessing of your time, expertise, long hours on Tuesday to respond to our questions. Thank you for understanding. We esteem and appreciate you more than you know. Well, thank you so much. You're made in the image of God. You are going to be eternally my brothers and sisters, so I better treat you well now. Deanne goes, oh, she has a joke for me. Okay, do you know why there was concern about the elephants getting into the water? Why was there concern about the elephants getting into the water? Oh, because they would drop their trunks. Because they would drop their trunks. Get it? That's a good one. I have one for you, Deanne. This is from my sister Debbie, and she said, what did the janitor say when he jumped out of the closet? And the answer is supplies. You know, supplies as in supplies in the janitor's closet. Oh, okay. All right. So much for silly jokes. Thank you, Deanne. Thank you for that. All right. Last page here we have Bor says, oh, I think I answered this already. Hemoglobin A1C, I'm conscientious. Yeah, so that was a duplicate. We covered that one already. Okay, Cynthia. Hello, Dr. Ellithorpe. Thank you for taking our questions. My husband and I are TLC patients and are taking EDTA suppositories to purge metals from our systems. Very good. We have noticed changes in bowel movements, general tiredness, and increased thirst on days after using suppositories. Is this to be expected? Yes, I would say, because you are moving toxins. Also, does EDTA therapy bring out underlying or dormant ailments in the purging process? In general, no. It's just removing oxidative stress. And just like if you worked out real hard and you felt kind of after a hard muscle workout, when you move oxidative, stressful toxins out of your body, you might have a day or so of feeling a little, but it will diminish as you start getting in a pattern. This will decline and decline until, I guess, like at my age, I've done so many chelations and so many suppositories. I don't feel anything anymore, and I feel clean as a whistle. Vanessa says, hi. Do you have any tips or supplement recommendations for sleep, aside from hormones and melatonin? Yes, Vanessa, fat. It's very valuable to get enough fat in your diet. So I would emphasize fatty foods like prime rib is a fatty meat. Eat the skin on the chicken and maybe butter it before you eat it. Eating butter with all your meals and your vegetables, be low carb. I would recommend shrimp and crab and lobster and all the fatty fish, salmon. Eat plenty of fat. Now, what you could do is take some herbal hot tea, like sleepy time tea. These have these natural relaxing herbs in it, and put a big tablespoon of butter in it. You might put a dash of minerals or Himalayan salt in, and take in the daytime TLC methylated B complex for the pyrophosphate B5 in it. That will help you with your sleep and your vitamin D, which is fat soluble. And what you're doing is you're talking to the brain stem here that is really stressed out with the microwaves and our diet and our stress and our high sticky carbs and our circadian rhythm and the light stress, the blue lights. And so the fat helps to heal it. The minerals help to heal it in the salt, and the B5 pantothenic acid in a high quality B complex with vitamin D. Try that. Cynthia says, Dr. Ellithorpe, what can cause muscle cramps in legs, feet, hands? Thank you so much for these videos. So informative. Well, they don't actually know what causes these leg cramps. And I really think it's the cell membranes here. And these cell membranes have little holes in them. And as the day wears on, your volume of tiny micro damage, I always have on my desk here for my patients, showing them my wiffle ball, pickleball. And it's just showing them all the free radical damage, even from your own mitochondria, reactive oxygen species shooting out, damaging that phospholipid membrane. And the only way you're going to get that repaired is if you eat enough meat and chicken with the skin on it, and fish and egg yolks and stuff. And they frightened us all away from it. So eating fat is soothing, calming, and reparative, and life extending, and youth preserving, and just preserving of the endothelium of your blood vessels, all that. Being well hydrated is very important, and having good electrolytes, the potassium, because when you poke a lot of these through the day's use out, the potassium sodium ratio balance between the cell gets disturbed. And when that delicate negative, positive chlorine ions gets messed up, calcium ions, then it creates a depolarization and activation of that cell membrane, which can generate a muscle contraction. So you need to eat fat. You need to have your minerals, a good multi-mineral with potassium and calcium and magnesium in it. We have that in our TLC multi-min. That's what I take. I eat a rich, almost 100% carnivore diet, and good hydration, and that's what I would do. Vivian, I have acid reflux. It's gotten worse in the last year. I am taking Kirkland Signature brand omeprazole, 42-day course. I took a week off and it came back with a vengeance on Saturday. In fact, it made me feel so ill I couldn't finish eating. Is there anything I can do that is natural? I don't like being on drugs, but I can't take this acid reflux either. Any insight you could share would be very helpful. Thank you so much. Well, this is it, because the lining here, the tube that is going through the diaphragm into the stomach down here, that's where you're getting this burping up of the acid. And so the solution is not to stop the acid, because that's dangerous long-term in and of itself. It's in having something that will repair the membranes. And what are those membranes, the lining of your esophagus made of? It's made of these fats, phospholipids, to repair the little acid micro damage. So if you took a scoop of this in warm water with some protein to help repair the fat and protein membranes here, and you mix this in some warm water, and you do that first thing in the morning, last thing at night, first thing in the morning, last thing at night, and probably take a good probiotic. Stop eating absolutely by 6 o'clock. Drop your fork. I don't care if you're at the king's dinner. You just drop your fork and you don't eat late. Take a walk to promote the digestion moving forward. And you will find that you will heal here. Let's say you're in the middle of a day at lunch and you just were fasting all the way till noon and you get the heartburn. Well, go ahead and take a midday dose. I mean, this is food. These are natural things, the building blocks of repair there. All omeprazole is a chemical hydrogen H2 blocker, and it just says make less acid. Nothing about repair. Nothing about repair. So it'd be like coming along and saying, okay, you have a drip on your faucet, and the guy comes and he shuts the water off to your house. All right, I fixed the drip on your faucet, but now you have no water in your house. So you've got to use your gut. So let's repair it with the things it's made of. Let's have doctors learn how to use natural things. I'm not saying you can't use some omeprazole for a short period of time, but you can use this every day. And I have mine here on my little office kitchen desk here. Because I need it, and I'm getting older, and that little sphincter there is weaker as I age, so I use it all the time. And then the last one is Marina. My daughter has hyperpigmentation issues that started in 2021 when she was 13. The white spots started on her legs and some on arms and hands. Now it has spread to her left side and abdomen, more on her left leg. What natural remedies can I do? Shower only with Selsum Blue, selenium-rich shampoo that's designed for your hair, for dandruff and stuff, and let that Selsum Blue get all over the body in case there's a fungal skin component. And again, I'm just going to say it. You got to get them on a protein-rich diet. And then, is there anything I can do this natural? I don't like being on drugs, but I can't take this as, oh, wait a minute. All right. So any natural remedies I can do? We've seen a doctor and she did blood work and talked to us about the diet. But we already eat pretty clean. My daughter is a picky eater, though, so I wonder if her pickiness and love of sweets, well, absolutely, that will create an autoimmune problem in her gut, which will create a leaky gut, which will create cross-reactivity, mimicry, and then attack the skin there. Yeah. So she's got to get a complete digestive stool analysis and a food allergy, immunoglobulin G. And I'm sure she's not overweight. She rides horses, loves animals. I wonder if she picked up some kind of fungus or bacteria. So have her shower always and only with Selsun Blue. Only, period. And then have her eat the cell membrane skin protective phospholipid-rich diet. And see a doctor like one of us, a good functional doctor who will do a complete digestive stool analysis and the immunofood allergies and help teach her and then screen and see, we're seeing more teenagers than ever before have liver transplants because their horrible diet is full of high fructose corn syrup, lattes, frattes, soda pops, Slurpees, junk food, high fructose corn syrup, and it's just destroying their immune system, destroying it. So she needs to have her insulin done, her hemoglobin A1C, her fasting blood sugar, her triglycerides, and her fruit sugar level, fructosamine. And with that, it's 7 o'clock, or, oh, wow, it's after 7, so I got to end. Love to be with you. I will see you next week, but I want to tell you all about, I have the speaker coming, and this is Elizabeth Terrell, and she's going to be talking about the World Health Organization. She was working with Ron Paul and Rand Paul. She's a healthcare provider, and she's going to give us some warnings about the danger of centralized government control through the World Health Organization dictating all of our health care policies concerning pandemics. So please call for a ticket. We're having it here at the clinic August 30th, Wednesday evening at 7 p.m. in the IV suite. Hope to see you there. All right, folks, God bless. Thank you.